Hi, I'm Dale Sherbeck, and welcome to the HQ, a CHA Learning and Healthcare Can podcast serial where we dive into the healthcare issues and topics from the perspective of its people and discuss them with those that are leading in the health system. Together, we'll try to unpack these topics and learn what actions are being taken to innovatively solve them today. Over the past 2 years, we have been inundated with media about health and healthcare. During much of this time, it has focused on COVID-19, pandemic numbers reported daily, and ever-changing policies as our world and communities have grappled with containing the virus. But there was always another narrative running through this about the impact all of this was having on our healthcare system, and indeed many of the policies that have been developed over the past 2 years have been presented in terms of how we can protect our health system and facilities from becoming overwhelmed. Increasingly, this narrative has been morphing and moving away from the inanimate parts of the health system, away from discussions of PPE, beds, ventilators, and ICU capacity, to the impact all of this is having on the people who work in healthcare and the two-front crisis our system is facing: the health and wellness of these workers and the shortage of people who make and deliver our health system. The two issues are integrally linked, and by all accounts, they are not singular in their cause or solutions. Here on the HQ, I want to use this platform to look at things from different perspectives as we try to understand other facets that might not have been discussed. Consider, what is it like to be a healthcare leader during the pandemic? And when we talk about shortages of people, why are we talking about immigration and how it can help us out of this crisis within our own country? So today, in this special two-part episode, I'm joined by Kristen Winter, Vice President of Human Resources, Workforce Optimization, and Leadership at Sunnybrook Health Science Centre in Toronto. Hi, Kristen, and welcome to the HQ.
Hi, thanks for having me, Dale. Appreciate it.
So, Kristen, as we set the stage here and get ready to dive into the discussion today, maybe you can help frame it a little bit about how does a person like yourself end up being the Vice President of Human Resources at a large academic health science center in Canada?
It's a great question that I ask myself on a regular basis. How did I get here? But thrilled that I get to be here every day. I went to university for in communications and sociology. I love the idea of people and how people interacted with each other and how they responded to each other. And I thought I needed to figure out a way to have a career in that. And then I did a postgrad diploma in human resources. And then subsequent to that, in the last 5 years, completed a master's in education and leadership. And then I essentially just worked my way up. I joke with people that are starting in their career. I started in the mailroom, working for Hydro, and slowly had an opportunity to explore all different industries, from private sector and then into healthcare. And every step I took, I sort of had an opportunity to be exposed to different areas of HR, and ultimately landing myself in the vice president role here at Sunnybrook. I love healthcare. I love working in healthcare. And, despite the incredible challenges we've had over the last 2 years, I wouldn't want to be anywhere else. And I certainly wouldn't want to be anywhere other than Sunnybrook. It's an amazing organization. We do amazing things here. And I'm incredibly proud to be the VP of the people that care for the patients and their families that come here every day.
Thanks, Kristen. Yeah, it's certainly reflect on my own career, and there's no way I would ever imagine that I ended up where I am. So I always look envious at people who've taken a sort of a straight path to something that they've dreamed of doing when they were 10 years old. So, Kristen, we've all heard or seen the impacts of COVID on the healthcare system, and especially on the workers who are at the front lines. I know for me and for so many of my colleagues, it's a heart-wrenching stories that we see and hear every day. But I'm struck that we don't hear about how it's affecting people like yourself in roles like yourself. So maybe we could start the conversation about what is it like to be a healthcare leader during a pandemic?
So, it's a great question, and you're right. We don't ask it a lot, and appropriately, we give the time and attention to the roles that are frontline caring for the patients. And certainly in wave one, that was important because we really didn't understand what COVID was or how it transmitted, and trying to understand that and give a sense of calmness to our staff was probably one of, if not the most important thing that we could do as leaders. And so I guess I would start there, which is making decisions, quick snap judgment decisions, often in a space that was really new and unknown to all of us as leaders. So we were being looked upon to have the answers, as we do as leaders, where it's often our responsibility to have the answers to the questions, whether they be easy or hard questions. And during wave one, and then most recently with the Omicron wave, really not having the answers because everything was sort of unfolding as we were learning it and trying to figure it out and then trying to respond accordingly. So it was hard. And the best analogy I can give, it's like leading in a fishbowl, because everybody is watching what you're doing. And as you do your backflips, people are watching, and they're either cheering you on or challenging your thought process. And in all honesty, it's about being incredibly honest and transparent and being candid when we didn't have the answers, being able to say to our staff, we don't have the answers, but we're trying to figure them out. And I think that's been a big part of the lesson here, is being comfortable in the space of saying, I don't know. As a leader, we're typically like type A perfectionists. We want to do everything that we can. We want to do it correctly, and we want to do it well. And that's often how we've landed ourselves in these roles. And in the space of COVID over the last 2 years, it's been challenging to be able to have all the answers. And sometimes we've had to pivot. I mean, many times we've had to pivot and say, hang on a second, that decision we made 2 weeks ago made sense 2 weeks ago, but it doesn't make sense anymore. And things changed so quickly that we were having to do that on a regular basis. And so it felt, as leaders, like we were a bit of a yo-yo. And quite frankly, it probably felt for our frontline staff like we were, being undecisive. And the reality is things were changing as rapidly as they were, particularly both in wave one and then again with the Omicron variant. We were being asked to make those quick changes to a place where it was sort of feeling a little bit like we were dizzy on the regular basis. So I think the hardest part has been that. And I think the second piece, in healthcare, we tend to be pretty collaborative. We tend to seek opinions of many people before we make, decisions, before we make changes. And during various periods of the last 2 years, this pandemic has forced us to take a bit of in a positive way, but a bit of a command and control decision-making and leadership style. And that's not a typical healthcare leader style as a general rule of thumb. Obviously, I'm generalizing, but, having to take that command and control and say, no, we're not doing this. We're doing this. Here's how it's going to work. These are the steps we're taking. You need to move forward, and not really giving any space for deep or daily and rigorous discussion before we make a long decision. And of course, we did our best to be collaborative as we could, but sometimes decisions were being made at 11 o'clock at night so that we could make sure that we had enough staff on the unit, or we had enough resources. We were making decisions on, every day was a work day. There was no day off. Christmas Day, Boxing Day, the stats that followed that this year with Omicron were days that, like any other, were working days for all of us, or many of us certainly. And, I think, you have to step in and just kind of make the decisions that you have to make sure that everybody is as okay as we possibly can. So I think that's probably a really long answer to a short question, but I think, it's been really tough because we've all had to change our leadership style to modify or to accommodate whatever COVID has thrown at us throughout the last 2 years. And it's been different throughout the 2 years. It's not been consistent, which is challenging.
Yeah, so there's, a few things that come to mind in terms of what you've just been saying. One is, with the shifting policies and the changes, the yo-yo as you describe it, does that sort of lead to an erosion of trust or a change in terms of how people sort of respect, things that are coming from you or for your colleagues?
I think I think there's certainly risk of that. My sense here at Sunnybrook is that we didn't have that, and I think there's a couple reasons why we were relatively successful. And we were not perfect, because I don't think anybody was perfect, because COVID was new and uncertain, and nobody's perfect in a space that's unknown. But one of the things that we did throughout the pandemic, and we morphed it to accommodate the way staff wanted to hear from us, but we regularly communicated with our staff. Could we have been better? Sure, I'm sure we could have been better. But we did town halls. So for a long time, we did weekly town halls. So we asked staff to come forward with every question they could think of, and we would answer those questions sometimes on the fly. And we were able to give them as many answers as we could. And I think I said at the beginning, like, if we weren't able to give those answers, we were really honest and said, like, we're not sure. We're going to look into that. That's a great question. We really appreciate that question, but let us get the answer for that, and then come back to you. And then following up with regular communication to our staff. We have an online portal through our intranet that allowed staff to sort of review frequently asked questions and be able to get them. And then we had, I have a blog at Sunnybrook called Ask Kristen. And when employees have a question about anything, quite honestly, lots of questions come in, and they come directly to my inbox, and I actually answer them personally. And I aim to kind of have an answer back within 24 hours if I can, or at least a form of communication back to the employee to say, like, I'm looking into it. And so we try to keep the lines of communication open. Our CEO is incredibly outgoing and very on the ground. He regularly visits the units, and often one of the other executives will go with him and have frontline conversations with our staff. There was a moment, and I don't remember what wave it was, to be honest, but there was a moment where we had a unit that had a couple outbreaks. They had a couple outbreaks over the span of a couple months, and it was to no fault of anybody's. It just happened the way it happened, and the staff were feeling a little frustrated, I would say, and a little down that they were an outbreak again. And being an outbreak means a variety of things, but there is a layer of fear and being scared when you're in a state of outbreak. And it was a Friday. I don't know why I remember this so vividly, but it was a Friday, and I remember the PCM, our patient care manager, reaching out to one of our executive vice presidents and saying, the staff are frustrated. And so two EVPs and myself went up to the unit, and we just stood on the unit, and we stood with the staff for what felt like an hour. I'm sure it wasn't, and staff came and went and cared for the patients as they needed to. And but we stayed with the staff, and we just talked to them, and we answered the questions that they had, and we helped them understand why they were on outbreak, or what that meant. And we heard their fears, and we heard their questions, and we made sure that they understood that we heard them. We did a lot of listening, but we also did a lot of talking in terms of answering their fears. That's one example, but we did that countless times when we changed protocols, or when we were doing tracing of staff, or staff became positive and staff on the unit were concerned that maybe they'd been exposed. And again, like, a lot of this was wave one and the uncertainty of where we were at. We went to the units. We stood there for as long as we needed to stand there, and we answered their questions as much as we possibly could. Again, were we perfect? No, I'm sure we weren't. And I'm sure that there are staff that would say, like, this could have been done better. And we'll reach out and we'll hear that from staff. We did an engagement survey, and we're continuing to do those sort of check-ins. But I think those are ways we were able to maintain trust, by just being as vulnerable with them as they were with us.
It's it's interesting to hear. I'm wondering, did you see yourself in a position where you were, I think, protecting, I guess, a healthy culture that was already in existence at Sunnybrook, or were you creating a different culture that was responsive to what was happening around us?
That's a great question. I would say that probably a little bit of both. Sunnybrook always had a fantastic culture. It was one of the things that attracted me to coming to work here at Sunnybrook, was the culture and the engagement, the kindness that we see across the organization in roles from our environmental service partner to our food services worker, through to our clinical teams and our physicians. There's just a great deal of kindness and respect for every role that everybody plays here, regardless of the role you play and regardless of your salary or your title. But my style for sure is to be out there, and I like to spend time with the staff. I like to understand what they do. I like to understand their jobs. I think it's important as a leader to understand all of the components of the organization. So I think it's probably a little bit of both. I think there was definitely a culture here already that was really, really strong, but I think it's much easier to lose that than it is to build it back up. It's like when you're in first place, it's a lot harder to keep first place than it is to be in third and move your way up to first. And so I think from a culture perspective, I think it was very intentional, and we have an amazing communications team that's led by my colleague, our vice president of communications, and they get it, and they get how and the best way to communicate, and the multiple approaches to communication. So if Zoom doesn't work for people, then you do it in writing. And if writing doesn't do it, then you do it on social media. And if social media doesn't do it, you do it on posters. And so making sure that we were communicating in every way possible, I think was really, really important to our staff, so that they, if they were casual and they were only working, one shift a week, they were not missing out on the frontline visit from, our CEO and from myself.
Keeping everybody engaged in a meaningful way and keeping it fair, I guess, right? Mm-hmm. I mean, there's perceptions that we go through where life certainly doesn't seem very fair to a lot of people right now. So,
for sure.
So, in your role as a people leader, if we can use that word, is it different than for some of your colleagues who are, say, clinical leaders within different spaces? They have different responsibilities and different operational requirements. So what's it like to be, responsible for people when people are at the front of all what's happening?
Yeah, it's interesting. I've been in human resources now for almost 25 years. And when I started in HR, we were actually just morphing from the term being in personnel to being in human resources. I guess I'm dating myself a little, but we now all of a sudden, people were always very, very important, but certainly the attention has gotten significantly larger in the last 2 years. And so I think there's an enormous amount of pressure and stress associated with feeling like you've got the weight on your shoulders. I'm really fortunate because I get to work with colleagues, both my team, the people that report to me, that I consider to be my colleagues in my areas of expertise in HR and occupational health and infection prevention and control, along with a number of other areas. But I also have amazing executive colleagues who I can lean on and who never made me feel like I owned it by myself. And always were able to sort of say, okay, well, let's think about this from a perspective of the people, but also the clinical perspective, or what are we looking at from an infection prevention and control perspective, and how does that intertwine? And I think, although I'm responsible for the people, what we've learned in the last 2 years, if we didn't already know it, and I think in healthcare we were pretty good at this, but I think we've gotten significantly better, is the collaboration that you have to have between, the executive vice president and chief nurse and the executive vice president and chief physician. The three of us, along with my VP colleague who, runs communications, like the four of us all really just sort of became this group of people that sort of made those decisions. So I never really felt alone. I always had someone I could say, this is what I'm thinking. Does it make sense? Or this is what I'm thinking. And does that work from a clinical perspective? Because I don't have a clinical background. And can we make that work on the unit? Or, we have to implement handing out masks, which was like such a big deal back in wave one. And how do we hand out masks? And well, okay, so what does that look like from somebody who's working a 12-hour shift, or somebody who's working on the weekends, or how does that happen? And just like how you operationalize that. And that's not a decision that solely lands on one executive, because there's so many components and so many complexities to every decision we made in the last 2 years. So, I mean, I guess, yes, of course, I was responsible for the people, and ultimately, especially from an occupational health and safety perspective, particularly with the Omicron wave, and how many staff were off sick, and not necessarily horribly ill, but still not able to work, and the challenges that brought, which was obviously quite significantly different from wave 1 through 2 and 3. But I never felt alone. I never felt like I was doing this alone. I'm incredibly lucky that I get to work with amazing people, and they had my back every step of the way.
It strikes me that you're describing interprofessionalism right from the top, right, sort of perspective. That's what we seek, at all levels of our healthcare system. But you as a team sort of had to represent it and demonstrate it. So, I mean, what are you seeing with respect to your staff right now? I mean, you've described a little bit of, through different sort of waves about the fear and other kinds of emotions that were coming through. 2 years in, what do you see?
Yeah, I mean, I think like everybody in society, we're all pretty tired, and we're all pretty, I think it's fair to use the word fed up. It feels like, okay, are we done with this yet? It's been 2 years, and when is this going to be over? And I think there's a balance in healthcare. I think you've got that kind of thought process in society. Like, when can I go back to, not wearing a mask? Or when can I go back to, having all my family watch my child at their dance recital or the hockey game? Or when can we have, when can we have people cheering the Leafs on, or the Raptors, or whatever the case may be? So I think there's that component. I think the other piece that's really challenging for healthcare workers, it's unique for those that are in healthcare, is there going to be another wave? What comes next? And the fear that if we do start to live our lives the way we did in 2019, when we start to, get back to a state of normal, whatever that is that going to bring another wave? And are we going to be back into this? And I think it's incredibly challenging as a healthcare worker, because you're constantly balancing those two mindsets. And when you're in your personal life and you're surrounded by family and friends who haven't lived the pandemic in the way you've lived it, you spend a great deal of time living in that mindset. Like, I want this over, and I want to get back to normal, and I just want to have a normal life. And then you come to work, and, you see COVID patients, you see sick people, the numbers, maybe they go up a little, or the government makes a change to, things like vaccine mandates, and you have this little blip, or this little like gut reaction, like, oh no, is this going to be another wave? And I think for staff, there's that sense of fear. And I think you have to park those two sort of competing minds, if you will, and then add to that just exhaustion. I mean, that's the understatement of the century, in my opinion. We're past exhaustion. We're deep into the realm of burnout. And how do we get people back to a place where they love coming to work, and they love doing what they get to do, and they don't have fear, they don't have concern, and how do you give them that appropriate break? And all of that is happening at the same time where, despite COVID issues, we have what we're referring to as an HHR challenge, or a gap in the workforce that's available to provide support and care for the patients that we need to care for. So I feel a little bit like, as a leader, I feel like the weight of the world is on our shoulders, and as individual healthcare workers, it's hard to see the forest through the trees. You're starting to see the light at the end of the tunnel, and pardon all the analogies, but you're starting to see that light at the end of the tunnel. And the fear is, what if that light goes out? And how do we get through wave 6? Is that where we're at? I can't even remember. But if it is, how do you get through wave 6? And what does that look like? So I think there's so many things sort of happening, and then there's this level of uncertainty, and can we travel, and what does that look like, and how complicated is it to travel, and so how do people get a legitimate break? Not suggesting that travel's for everybody by any means, but how do we get a legitimate break, and how do we make sure our staff are able to get a break and then come back rejuvenated, and how long does that take? And so many things that are just unknown, because we've never been through this before. We've never been through this level of exhaustion and burnout before, and so it's a tough question to answer, and it's a tough situation to be in, and sort of try and take one day at a time. But some days are good, and some days are harder.
Yeah, I mean, you do worry whether this is just a mirage, right? Any sort of end to these things, and every time we hope, right, it seems threatened by something else. And we're not sitting on a beach, being buffeted by big waves once in a while. I think we're finding ourselves in an ocean where the waves are sort of eternal. So I mean, I guess also I listened to that and around the burnout sort of discussions, and I do wonder whether an interesting metric, would be how much unused vacation time organizations and individuals are sitting on, which is a lagging indicator, obviously, for how people have been working overtime and through this, and not just through a normal, but through a very stressful period of life and not getting breaks. So, I mean, how do you see yourself coming through this, even personally, Kristen, taking care of yourself? Because I know, from stories and conversations that we've had, that yes, you're working there, evenings, you're on, on weekends, you're working on holidays, which doesn't make you a martyr, but it certainly makes you a human that's, worked a lot. So how are you going to come back to normal? I hope you've enjoyed part 1 of our episode on the psychological wellness of leadership during the pandemic. Please tune in to part 2 of this episode to hear Kristen's response and more of our candid conversation, how wellness isn't a one-size-fits-all, and about how healthcare and our leaders will emerge from the pandemic.